With the burden of obesity growing to epidemic proportions, its detrimental effects ripple through different organs in the body, including the kidneys. CDK occurs when the kidneys have been damaged by underlying health conditions, including diabetes and high blood pressure, compromising the organ's ability to remove waste and extra fluid from the body. As the kidneys stop functioning properly, they no longer efficiently manage fluids. A buildup of fluid in the tissues can trigger swelling and weight gain. Studies have shown that fluctuations in weight increase the risk of stroke, heart attack and mortality among patients with coronary artery disease. In light of the fact that cardiovascular disease is the leading cause of death in individuals with CKD, researchers investigated the direct influence of weight fluctuations on CDK. High blood pressure, the exercise to avoid or risk hypertension. Expert issues warning. The study, which included 84,636 patients with CKD, set out to examine whether BMI variability may affect the prognosis of patients with kidney dysfunction. Over the course of the study, 6% of participants died, 4% needed kidney replacement therapy or dialysis, 3% suffered a stroke and 2% suffered a heart attack. Individuals with the highest body mass index fluctuations faced a 66% higher risk of dying, a 20% higher risk of requiring kidney replacement therapy, and a 19% higher risk of having a stroke and heart attack. Dr. Ki Kim, of Seoul National University Hospital, said, "This study showed that people who had kidney function impairment with recent fluctuating body mass index had a higher risk of cardiovascular disease or death, regardless of their current body mass index." Don't miss Jane Dancing Health, the star's tragic health admission. "I knew something wasn't right, Insight Cancer, signs you should never ignore, thousands risking their lives," warns NHS chief. Insight. The popular supplements linked to higher risk of hospitalization, expert issues warning. Tips. This result suggests that people with kidney function impairment should pay attention to their fluctuating weight status, and those with fluctuating weight may benefit from receiving appropriate screening and risk factor management to prevent cardiovascular disease or progression of their kidney dysfunction. The team also noted that the participants with a higher number of metabolic syndrome components had a worse prognosis. Metabolic syndrome is the medical term for a combination of diabetes, high blood pressure, and obesity. Previous studies have drawn a link between the syndrome and the heightened risk for heart disease, stroke and other conditions affecting the blood vessels. Symptoms of CKD. The NHS notes, there are usually no symptoms of kidney disease in the early stages. It may only be diagnosed if you have a blood or urine test for another reason and the results show a possible problem with your kidneys. The Health Body outlines some of the symptoms in people with more advanced CKD: tiredness, swollen ankles, feet or hands, shortness of breath, feeling sick, blood in urine. Choosing foods that are healthy will lessen the strain on the kidneys, thereby preventing the risk of further complications. However, treating the underlying causes of chronic kidney disease is the most crucial step in the prevention of CKD. Causes of CKD. There are a variety of conditions known to increase the risk of CKD in individuals, notably, high blood pressure. High blood pressure can substantially increase the chances of developing CKD. Treatment for high blood pressure and CKD include following a healthy diet, exercising and taking medications. Blood pressure should be controlled to less than 130/80 if you have CKD. Diabetes. Controlling blood glucose levels is of paramount importance when avoiding CKD. It is estimated 40% of people with both type 1 and type 2 diabetes will develop CKD during their lifetime. high cholesterol, as cholesterol causes the buildup of fatty deposits in the blood vessels supplying the kidneys. It can cause substantial damage to the organs. Studies have shown people with high cholesterol are twice as likely to get CKD over time.